Good morning, friends. Uh, Thank you, Dr. Mishra, for kind words. At the outset, I would like to thank IDEC, especially Sanjay and Neeta, for inviting me here and for this great opportunity. And a very interesting session on, point of view. And my point of view is obesity should be treated in fat but fit individuals. I don't have any disclosures. So in this presentation, I am going to do this in three parts. One, what is fat but fit obesity? Is it just a myth, or does it really exist? And should we treat fat but fit individuals? So let's see what is fat but fit obesity. So this, the concept actually, started gaining strength once Norbert Stephen and his colleagues described a metabolically benign obesity that was not associated with insulin resistance or early atherosclerosis. And surprisingly, they also showed that some of these people may be protected from cardiovascular risk because of high fat content. And this was based on this paper, which they published in 2008. The background was that they said possibly within obesity, there is a metabolically benign fat distribution phenotype which exists. And the study involved 314 patients. They were evaluated for total body fat, visceral fat, and subcutaneous fat. They also evaluated fat in pancreas and skeletal muscle and liver. And they also looked at intima media thickness. And based on the evaluation, they divided the subjects into 4 categories: normal weight, overweight, obese, and within obese, they looked at the insulin sensitivity and they divided into 4 quartiles. Now, the results were very interesting. They found that though the fat distribution, the body weight, the overall fat distribution was not very different in different categories of within obesity, but there was significantly lower ectopic fat in liver and skeletal muscle, and the intima media thickness was also less in people who were insulin sensitive within the obese group. And they concluded that a metabolically benign obesity that is not accompanied by insulin resistance and early atherosclerosis does exist in humans. Now, though these researchers agreed that they did not know the exact cause of this, but this did put this subject on the center stage. Now, we have number of studies in past which have shown that being aerobically fit actually is associated with lower risk, and people who are obese but aerobically fit actually may have lesser cardiovascular risk and lesser risk of mortality as compared to lean people who are not aerobically fit. So exercise is one of the important determinants of fitness. But distribution of fat or overall fat, and with this kind of study, now the spectrum of body weight appear to have a distribution, and at one end of spectrum you have people with normal body weight who are metabolically normal, but some of these normal body weight people are also metabolically abnormal. At the other end of spectrum, which we were calling obese, now within obese also, we started looking at people who are metabolically normal. So not all obese individuals are at increased risk. That was the emerging concept based on this study and some of the similar studies. So what is fat but fit obesity? Doctors call it something called metabolically healthy obese individuals. The press reported this as fat but fit. But whatever you choose to call it, since 2008, after this study, most of us who were carrying some extra kilos started to console ourselves or possibly deceive ourselves with the fact that possibly we have healthier hearts. Does this fat but fit obesity really exist? And the answer is possibly no, and it may be just a myth. In 2017, NHS issued this, that fat but fit people may still be at risk of heart disease, and the concept of being fat but fit may be just a myth. Another issue from NHS in 16th March 2018, again saying fat and fit at the same time, sorry, possibly it is just a myth. And we had a article run in Times of India, and we had number of studies coming to back up that possibly fat but fit obesity does not exist and it is just a myth. So if you look at the data, in last maybe 5 to 6 decades, we have sufficient data to show that obesity is detrimental to health. Obese individuals are at increased risk irrespective of the metabolic profiles, and fat but fit may be just a stage of transition between full-blown development of adiposity to full-blown obesity with associated risk. Now, this was a small study which we conducted in our hospital 2 years back. This study, we looked at the individuals who were coming to our regular health checks. So we tried to find out how many of the people are obese and how many of them are metabolically healthy but obese. So we screened about 1,600 odd people, and we found that 60% of them were obese, and within that group, 21% did not have any metabolic abnormality, and metabolically healthy obese we defined as absence of any component of metabolic syndrome. Most of the studies looking at metabolic health have actually used the parameters of defining metabolic syndrome, that is 3 out of 5, if they are present, it is described as metabolically unhealthy. But we excluded, if even one component was positive, we excluded that person as metabolically unhealthy. So we took metabolically healthy individuals as absence of any of the components of metabolic syndrome, and we still found 20% of obese people were like this. Now, we compared this with 60 healthy controls with BMI less than 23, which is cutoff for normal body weight in Indian setting. And we measured their HSCRP levels. And we know HSCRP is an important marker for vascular inflammation. And look at the results. Even within metabolically healthy obese, the HSCRP levels were almost twice as high as compared to the lean counterparts. So there is sufficient inflammation at vascular level happening in these individuals. Another important study, Epic-Morgan study, prospective cohort study involving more than 22,000 individuals, showed that metabolically healthy, abdominally obese individuals were found to have almost 40% higher risk compared to metabolically healthy, non-abdominally obese individuals. There are studies from Korea which showed that people who are obese but metabolically healthy still have increased coronary artery calcium scores, indicating higher risk for coronary artery disease. USLAM study, which was done in the Upasala adult population, again very important study, showed that compared to normal weight individuals, there is significant increase in the risk of developing type 2 diabetes in those who are normal weight and metabolic syndrome, overweight without metabolic syndrome, overweight with metabolic syndrome, and obese with or without metabolic syndrome. So even presence of metabolic health in overweight and obese individuals was not seen to be protecting them or keeping them away from the cardiovascular risk. This is a study which is published this year only, very interesting study, which looked at the metabolic health as a transient phenomena in the trajectory of obesity or the progression of obesity. So this looked at 6,800 odd people from multi-ethnic study of atherosclerosis, and these patients were followed up for 12.2 years, and they were tested for various interactions with obesity, and number of sensitivity analysis was done. The results showed that compared to metabolically healthy normal weight individuals, the baseline metabolically healthy obese individuals were not different. But MHO status was unstable phase, and more than 50% of these actually progressed to become metabolically unhealthy. And they looked at the interaction with the cardiovascular risk, and people who remained metabolically healthy throughout did not have increased risk for cardiovascular disease, but people who shifted to metabolically unhealthy state, they actually developed increased risk for cardiovascular disease. So this study again concluded that metabolically healthy obesity is not a stable or reliable indicator for future risk of cardiovascular disease, and weight loss and lifestyle management should be, advised to all these patients. Another important study published this month only in European Heart Journal which looked at separated combined associations of obesity and metabolic health and its association with coronary artery disease. This is a pan-European prospective study, tested the hypothesis of MHO, which is metabolically healthy obesity, and whether they are at increased risk of cardiovascular disease. The study was done in 5 lakh plus patients from European prospective investigation in cancer and nutrition with a mean follow-up of 12.2 years. Obesity and overweight were defined with BMI and metabolic function based on components of metabolic syndrome. Again, there was significant increase in the hazard ratio of getting cardiovascular disease. And if you look at the model 3 on right side of this slide, there is increased risk in people who have increased body weight and BMI. This study again concluded that irrespective of metabolic health, overweight and obese individuals had higher coronary artery disease risk as compared to lean individuals, and these findings challenge the concept of metabolic healthy obesity or fit but fat individuals. This is another study published this month only, again in the same issue of European Heart Journal, which looked at the confounding associations with adiposity measures and the incidence of cardiovascular disease. So this study was again large study, almost 3 lakh patients, database of UK Biobank, exposure to 5 different measures of obesity, which included BMI, waist circumference, waist to hip ratio, waist to height ratio, and were included. And they looked at the fatal and non-fatal CVD events in these patients. This again showed that there was the lowest risk was seen at a BMI of around 22.5 with J-shape phenomena. But J-shape effect actually attenuated once they looked at into the confounding factors and once they excluded patients with pre-existing comorbidities or illnesses that were actually causing loss of weight. So being thin was not seen as important factor in health, but it was possibly because of the pre-existing disease or other illnesses which is causing a patient to lose weight and keeping them thin. And as for the other parameters of obesity, which included weight to height ratio, waist circumference, and so on, everything had a linear association, and as the adiposity measures increased, there was increase in the risk of cardiovascular disease. And the study also concluded that any public misconception of a potential protective effect of fat on cardiovascular disease risk should be challenged and should be kept off. So according to this study, the BMI may be confounded by previous pre-existing comorbidities or illnesses, and actually it may not be relating very well to the CVD risk, while other parameters, which include waist circumference, waist hip ratio, waist to height ratio, and so on, actually have a linear association. And the study interpreted that evidence for obesity paradox is limited. CVD risk rises across the range of adiposity. So now, with this background, should we treat fat but fit obese individuals? I think answer is very clear. Obesity is associated with number of complications and comorbidities, and obesity is possibly mother of all important diseases of adult life, including hypertension, diabetes, coronary artery disease, and diabetes is especially one of the major risks associated with obesity. And we know that diabetes is kind of epidemic in India and growing in magnitude on daily basis. Not only that, there is sufficient evidence to show that as the BMI goes up, there is increased risk of cardiovascular disease-related mortality. And there are a number of studies which have shown that intentional weight loss in obese individuals is associated with reduction in diabetes-related mortality as well as cardiovascular risk mortality. So moral of the story is that obesity is associated with significantly increased risk of type 2, coronary artery disease, hypertension, increased CV risk and mortality, and obesity is actually comparable to poor health and must be treated in all, including fat but fit individuals. That is the point of view that I have. Thank you.